Baby. My baby.
Golf Talk Radio back in here. Hope you guys are doing well, surviving the storm. If you're listening on podcast, it might not be storming. Or maybe you're listening around the world, it might not be storming. It might be sunny. So we hope
your
you have
knees
a good
could be
day.
hurting, or maybe they're not hurting right now.
It's very possible.
But if they are and it's sunny, look around.
Exactly.
It's coming.
You can get our podcast at golftalkradio.com anytime, also at iTunes, and you can get us on iHeartRadio, Spotify, Spreaker, and Stitcher.
See, I knew you had some Sprinkers and Stitcher things going on.
And we thank the Pass Rebels Golf Club for partnering with Golf Talk Radio with Mike and Billy. Located in the heart of wine country, Pass Rebels Golf Club offers 18 holes of championship golf. Great bar, great restaurant, and live music will be coming up here soon on Wednesday nights. And you can make tee times on the web at passrebelsgolfclub.com or call us at 805-238-4722. All right, so we were talking about PRP, right?
Well, we're talking about procedures for. I have a torn meniscus, and I've had an MRI, and it was proven that it's torn. So how badly torn, I don't know, but bad enough where the surgeons recommended surgery. But as you all know, at least you two know, that I postponed that, which was scheduled a week ago Thursday, for various reasons.
Because the storm was coming in, for one thing.
Yeah, it was very clear weather, and there was very low barometric pressure.
Yes.
But because of the research that my wife did, and you guys, and your doc's professional diagnosis and opinion, and he related it to Mike, and Mike was kind enough to relate to me, and I decided I'm not going to do this, and I think it's a great decision as of this minute because I'm in zero pain, although my elbows hurt, but that's a whole nother thing. So we were talking about if it does happen again, and my surgeon told me, everybody does this postponement. Almost everyone comes back later. And I said, if that happens, cool. As long as you let me in, that's what I'm going to do.
Right.
But I'm going to wait because I couldn't understand getting, my body have some kind of a trauma done to it intentionally without not being any pain in the first place. So that just makes sense. Right. And I think there's better options. So PRP was suggested by a parent of a student of mine who said that he's been using this on his shoulder for a long time, and it's been done miracles. And I didn't know what that meant. And I still didn't until Doc just explained what it means. So, Doc, what are your thoughts on PRP? Because I know it's an option for treatment for my meniscus issue. What is it?
Yeah, I think it's a great option. Whenever you guys ask me questions, I always think of a polytherapy approach. So
Therapy, PHA.
The reason I mention that is because if we just go in and do the PRP and we don't change the biomechanics to the knee and the pelvis and nerve innervation, blood flow, and the health of the blood, you're likely to end up having the issue come back. So there is a possibility to restore this, but you got to make a lifestyle change. You can't just look at it as a deal with the one symptom. So the platelet-rich plasma is what PRP stands for, and what they do is they take your own blood, they put it in a centrifuge, and they bring out the platelets and basically leave what's left is a bunch of growth factors and immune proteins, and then they inject it back into the site that they want to try to regenerate it. That would be a great option. One thing that we find is when people do that and we add the cold laser therapy, you guys know I'm a big fan of cold laser therapy, people get really, really good results. I had the last two years ago, a gentleman came in with a meniscus tear on MRI, and we used the laser therapy. We did all these things. We nerve supply, talked about diet and all those other things, and he's out playing baseball again and going to baseball camps.
Did he do PRP or not?
He did not.
He did the cold laser therapy.
I've done the cold laser therapy.
So let me ask you, and not to sound, I'll just ask it. Have they done placebo tests where you use just a light versus the actual laser on these same people or studies, and they have wow, this was great, I feel better, and it was just the light?
So that's a great question. I have not seen any laser with just the light. They have done it with like infrared. And
something that's not the same. You're not really. Yeah, so it looks exactly the same, but it's.
Yeah, I haven't seen any studies that have done that. The studies I've seen is it does work.
Well, obviously, because you're using it.
Right. What I like to do, and I always tell people, the nice thing about when you're using a cold laser, there's a check in it. So what I mean by that is if you don't respond within 3 to 4 visits, like you don't notice any difference, we don't go forward. So there's a really good way to figure out if it's going to work for you
So it
or
works
not.
for some, or if it doesn't work, it could work for some, not for others.
Yeah, I've had that. I mean, because it's supporting the body's natural ability to the healing response. So if you have a lot of metabolic issues, blood sugar issues, poor diet, diabetes, which I just mentioned, cholesterol, high blood pressure.
You had a hard time not looking at me during that sentence, didn't you?
No, I was just concentrating, Billy. Just concentrating.
Come on, you know you want to glance over
You
here.
always have me on edge. You notice it. You notice every time
I'm the
I come
least
in,
edgy person in the world.
No, it's because
man.
every time I come in, you notice I have more notes.
I know.
Now this time I have my computer with me because I don't know where you're going to take me
You're
with
so
this.
funny, and I don't mean to put you on edge, but I am the
You're
least
good.
edgy.
No, it's fun.
But I do want to ask you and you mentioned back to the PRP really quick.
Yeah.
They spin this stuff and you get the positives. Does it spin out the toxins and the stuff from my poor diet and my poor and all that stuff? Does it get rid of all those things? Because I know you got to start eating better so your blood is better and we've had this discussion many times, and that's why I tease you.
Yeah.
But is that one of the reasons for spinning out the bad and just keeping the good? To be very layman on that.
Yeah, I'm not. No, that's not. PRP is not my specialty, right?
I know, but they spin it for a reason.
Yeah, because they just want the growth factors and the immune proteins. They're just trying to get to what are the building blocks.
So the bad whatever's out.
Well, it's not bad. It's probably not. I hate to say it, not necessary, because I think everything in our body that's produced is necessary.
Because and I mentioned this because you mentioned the way I eat and what I eat could help my skin and all kinds of things, and it's because I got to eat better, get less on the cheese, and do all these things and stuff because this will help you. And we had this conversation.
Right.
So that stuff must go into your blood, or so I don't know how it all works.
Well, so it's a good question, and that it gets into basically your body releasing immune proteins, which are pro-inflammatory, and histamines, and that gets into the whole other conversation about allergies that we probably won't get to.
Right.
Because basically what we're talking about is pro-inflammatory hormones. Anytime you start releasing inflammation or doing things that cause inflammation, because the body doesn't differentiate.
Right.
So if you put a lot of stress on your knee and it's damaging the meniscus, you're creating inflammation. If your diet's poor, it's creating inflammation. All these things start happening, and it just creates this cascade. And so, it's a lot harder to heal when the body's so.
And that's why some of the cold laser treatment might not work on somebody who's got a lot,
a lot. I see it all the time. People, if the poorer their health, the less likely I find it's going to work. So when someone comes in with that, I take their blood work. We start working on the metabolic side. The blood
before you go.
Exactly.
Cool.
And then once we've done that,
it's a pre-shot routine.
It's a pre-shot routine.
It's building up.
Before you execute
routine.
the perfect shot, you've got to get a pre-shot routine.
Exactly right.
So you don't just jump right into the hazard and you flail at it.
Yeah. And some people are like, I want to do that, and I say, okay, but you get this is what you're risking: more time, more money.
You can't Happy Gilmore this one.
No,
you don't just run up and just whack it. So that makes total sense.
Yeah.
So, and that's kind of when I went and saw you. There was before we started doing all this. Let's get this, and this. Yeah. And then this cold laser, which I know you've worked on, Mike, and stuff as well. It could have a huge benefit.
Yes.
If you're in the right place and the right physical.
Docs used it on my knee.
I noticed the other day at our house when the lights went out, you glow. You had a little glow to you. I thought that was pretty cool. I thought it was your aura at first.
That's a whole different thing.
It's actually layers of laser.
Yeah. Docs used it on my right knee. I had some problems with my right knee. Awesome.
You still doing those 150-pound squats?
No, but I did that, and then I got some stretches from him after that. No issues.
And it's not something you have to keep coming back for. No. Usually it deals with it, and you're done.
Could you actually shoot it from your office to his house?
Maybe the quantum physicist should answer that question.
We'll be right back, guys. Clubbing with Dave Schmanel on the other side. Stay with us. Golf Talk Radio with Mike and Billy.